there's some building blocks of health, and there's nutrition, there's physical activity, and there's just general health literacy, knowing about yourself, how you need to stay healthy. And so with every one of those things, we know we have some deficiencies in how we promote that, particularly among the youth. Years ago, I did some focus groups within the city of Grand Rapids, and I identified what was the pressing issues for the community. And what we found was education was the number one issue that people felt compelled to do something about. They felt there's some deficiency there. The others were civic engagement and health. And so what happened as a result, the school system established what's called the parent university, and it's through those that we were working with parents to help them teach. One of the things that they said with education was that we have a high dropout rate for minority populations, somewhere about 70%. And they said, where our kids are failing, they're going to end up with, they're not going to have viable lives if they can't get educated. And the subsequent question I asked was, who do you feel is responsible for that education to do that? And they said, we are. We are as parents, but we don't know how to create that learning environment or how to foster that learning in the home. So what we did was establish this parent university to teach parents how to create a learning environment at home. What do you do at home? Because some people, when their children get home, or maybe they're not home when their children get home, is you get home, you do homework, you study, you read, and then there's things that you do as behaviors that they encourage learning. So that's what we did. This is how you might want to set up a learning environment. You create a space where people can, or children can learn, can read, can make this enjoyable. And so we did that, and we saw that the dropout rates actually declined because of this. And so we're using that same framework for teaching people about health. So we're working with the school systems where the superintendent has been very proactive working with our registered dietitians and changing the menus, because the food that we're getting was institutional, very highly processed foods. It was not healthy food. So, and this is where I tied in the healthcare system, say we're serving really bad food in our cafeterias. We need to change what we do so we can set examples for all these institutions, because food access and what we do in restaurants, what we do in schools, what we do in other institutional places is important. It's impacting the public. So we need to find a way that collectively we can make a difference. And so that's what we're doing. But if you change kids, actually kids are easier to influence than the adults are. And so we work through the school systems. Actually, they're driving that sort of change up. And kids, if you give them a chance to be physically active, they're going to be. If you say, you can either do math or you can be outside playing around on the playground, they're going to do that. And so if I can tie in mathematics and physics with what they're doing in the playground, they're going to love that. And so because it becomes real, it becomes fun, and it develops them not just physically but mentally. So that's what we're doing. And so we're trying to, again, measure to what degree has this had an impact. We have what's called a school health advocacy program. We know that if by third grade they're not literate, they're going to fail. They're just going to drop out of school. So we measure that. To what degree is somebody kindergarten ready at 4 years old? To what degree have they increased their literacy rates as they progress? And to what degree are they literate at third grade? And that's a predictor of academic success. So we're trying to, by third grade, to be able to do that. In some neighborhoods, we have about 80% illiteracy rate, and that's simply unacceptable because they end up being, not being as able to contribute to society as we want. So we're working on literacy rates. We also know that there's a connection between attendance and healthcare. If somebody is ill a lot, they're going to miss school a lot. And if you miss school a lot, you're not going to academically perform. So we have nurses in the schools that work with kids that have some health issues, chronic diseases, and help them manage it so they don't have to go home when they get sick. They stay there, and we help them stay there and be academically high performers. And then ultimately is they have to graduate from high school and then enter into college and then have retention rates there as well. So we're working with them to do that as well. So education is critical in that.
Going off that, I have a quick statement. I was going to say, going off that, it's not only accessibility that's the issue, it's affordability. So if you go to the grocery store that's nearby and you see an apple costs $1.50 once you get to the register, but a bag of chips is 2 for 1, a water bottle is $1.99, but an Arizona iced tea is 99 cents, you're going to go with what you can afford. And that's what the huge issue is. We need to change the affordability for people to be able to access and take those healthy foods home and consume them. You have a question?
Oh, sorry. I think it might be, I don't know. I don't have any special knowledge of public health, but I recently heard a study that seemed fairly convincing about the amount of time patients have with a doctor having a really statistically significant impact on their health. And just regardless, it's just an extra 5 minutes making a very significant impact on their health. And that seems like a really amazing and easy thing to do on the surface, but it actually struck me as maybe one of the hardest things to do because ha- doctors' time is and access to doctors is probably one of the tightest resources. But I'm just curious, based on your knowledge, if that's true or if it's actually something that would be easy to do.
I think it's very true, and not only does there's not enough time during the appointment, a lot of patients are leaving their appointment and they forget everything that they were told. So they'll leave with all these prescriptions, and then also we don't really have um, a cohesive electronic medical record. So you're going to multiple doctors and you're being told multiple things, and you're getting multiple prescriptions, but there's nothing that's secured. Exactly.
The average time that a person spends with a physician is about 5 minutes, and they spend about 45 minutes in the office waiting, and and so the time isn't there. One of the highest predictors of wellness is called quality or activation measures. There's an instrument called the PAM. There's a patient activation measure. So when somebody enters our program, we do this assessment at the start. So it measures things. To what degree are you engaged in your healthcare? What's the quality of relationship you have with your primary care physician or your provider? And we find that it's very low. And there is a correlation. As your activation measure increases, your wellness will increase as well. That's the highest predictor. It's a much greater predictor than to what degree are you exercising or to what degree are you engaging in healthy eating. So that we need to impact more, and providers as well. They're busy. Physicians are busy. So what we've done is we have what's called community health workers, and these are people that we hire from the community that then interact or they translate what a primary care provider is telling them, or maybe if they don't have a primary care provider, because we have people who are undocumented, they don't go see physicians, so they work with a population and say, here's what we can do, and so they have this trusting relationship, and now they have the dialogue about, well, what is this lipid panel? What do these numbers mean? Cholesterol numbers, hemoglobin, A1C. What does this mean, and how do I impact this? So this sort of health literacy is important, and that increases this patient activation measure, and then we can measure that, and that's a great predictor, and we found that to be very successful in terms of doing that. We're not going to change the healthcare industry with regard to providers, and actually it's going the other way around, where we're using less providers and using more community health workers, using more nurses, and people who are parapros out in the community, because that's where healthcare really occurs. It doesn't once you're in the hospital, it's too late. And so we're trying to get out into the community and impact it that way. And we know that an appointment for a provider, it's great. You could spend a lot of time, but they also need to have quality time. It has to be valuable. They need to know when they go in to say, I had this number on my lipid panel. What does that mean? Well, what do I need to do about it? And to make them literate about their health itself. So that's what we're trying to do, is impact it that way. So it is. We've studied that as well in terms of the predictors of wellness and how people can maintain health.
Oh, so,
Yes, this is called right place care. And so this is when yeah, there is, and so this is where people they should be, again, health literate enough to know where they should go when they have a certain issue. If they're having heart palpitations, or they're having some pain on the left side, they need to go to the ER. If they have sniffles, they can wait. They can go to that's not urgent. And so this is educating the consumer about where they should go, because it's expensive for them to go to the ER as well for this sort of thing. And they shouldn't do that. That's so they need to go to the right place for the right care. And so we're trying to do that, educate the consumer about where to go. There's an example. There's one program that we run. It's out in a rural community, and we thought, we're going to reduce EDUs, we're going to reduce hospital admission, and we were working with patients that had chronic diseases, and some were getting a little bit more higher acuity as well. And what we found was, after we gave them we were in the home, worked with them, coached them on right place care, and all of a sudden we saw the rates of ED use just go up. I thought, what's going on here? And it's because there's a lack of primary care physicians, but they were having serious issues. Their blood pressures were just skyrocketing, particularly those with chronic health conditions or heart conditions. But it was appropriate for them to do that. It's just they never thought about doing it, but now they're doing the right thing. In most cases, you want to try to keep that down, but for people who are generally well, we need to teach them. This is where you go when you're ill, or sometimes you don't have to go. Just just check online. So we're using things like e-health, so somebody can communicate with a nurse and do it electronically instead of having to go in and do a visit. So you can just kind of check in and say, I just want to talk to you for 5 minutes. Here's the thing that I've got, and they can get that coaching right through an iPad or something, and that's a great tool as well.
Oh, yeah. This is kind of a broad question, but do you guys think like Obamacare has been successful or not so much, or what do you guys think about it? Oh, yeah, sorry.
Sure. The Affordable Care Act, or otherwise known as Obamacare, is a plan that's a federal plan that provides health care for it's a nationalized healthcare system. I think in theory it was set up to work and provide healthcare insurance coverage for people for healthcare. In theory, it was a good thing. However, in application, it's turning out to be not to be as impactful as it was. Insurance companies had their hands in terms of revising this plan and making sure they had some profit. That was their goal. It wasn't necessarily to make sure that people had access to healthcare, but that they would be able to profit from it. So you have people who pay deductibles as a result of getting enrolled in the system for healthcare or health insurance. And so what we find is people, although are insured, they're underinsured. An average, say for example, if you're low income, an average annual policy is about $10,000 per year. People can't pay that, so if they do pay it, they're paying about $500 to $600 per month, and they're not, and then that's with a high deductible as well. So they're not really taking advantage of it. So although they're insured, they're underinsured. They don't use it, and it's really they're insured for catastrophic illness. That's what they're using for in case they have a heart attack or going to be hospitalized for days. That's what they use it for. That's what the benefit is for. But beyond that, it's not really been effective in terms of providing any benefit for preventive health care, that sort of thing. And so I think the theory was good. It's not yet been as effective or as impactful as from a public health issue as it could have been.
I have two questions. One is, what are you doing? You mentioned toxic food and stuff like that. So, what are you doing to ban such toxic food in all these places? And my second question is, you mentioned proteins and stuff like that. Now, how are you making sure that the children get those proteins? People who are not able to buy that kind of food. So, how do you make health food accessible to children who cannot afford it?
Sure. Well, in the United States, it's a lot of things are driven by perhaps capitalist enterprise, and you talk about banning toxic foods, and that's fine, but you have major organizations or companies that are effective lobbyists, and so they influence legislations so to ban something that's toxic, and they know it's toxic when they put it in the food,